We will be discussing the complications of transradial approach. Like any other approach or any other procedure in the field of medical science, transradial approach also is not totally free of complications. There are complications and there are solutions to it. If you see, most of the complications are minor complications. As for example, this is an example of mild hematoma of the forearm. Another example, a bigger hematoma of the forearm with the discoloration of the skin. This is an example of small pseudoaneurysm. This is an example of depigmented scar which happened because of very severe pressure applied on the artery after the intervention. This is an example of infraclavicular hematoma because of the perforation of some branch of the axillary artery. These are actually very rare complications and they can be dealt with without much of the problem. Radial artery occlusion is also an issue which we are going to deal separately in the later part of this DVD. Radial artery spasm is also an issue which we are going to deal separately. Radial artery spasm and radial artery occlusion are also important complications and we are going to discuss at length in the later part of this discussion. Now, I will show you an example of radial artery perforation. There you see a plastic cannula for radial puncture. The blood was coming out, the wire was not entering it inside beyond a particular point and there were repeated attempts with the wire to move it forward and that led to injury and perforation to the radial artery, and when we injected contrast through the cannula, the perforation was revealed. We will be discussing how to tackle the perforation in the later part of our interactive discussion.